Hi, everybody. I'm Tash,
And I'm Damo.
and we are so very excited to bring you this week's episode of the Bari Chronicles.
Today, we are talking with Kylie Murphy, who is a registered psychologist specialising in bariatric surgery. So excited. Kylie, welcome to the Bari Chronicles.
Thank you so much, Kylie.
Hey everyone, so we're here with Kylie, our amazing psychologist specialising in bariatrics. So, actually, in our new studio that we're moving to, we've actually got sound effects that we can add while we're talking. So
that will be great. So next time there'll be a round of applause.
Yeah. So welcome to the Bari Chronicles.
Thank you.
So where to begin? How did you get into psychology and specifically the bariatric side of it?
Okay, huge question. Goes back a while now. Interestingly, just decided psychology is actually a second career for me. So I actually came off a marketing communications background.
Okay.
Yeah, and research. So I was very used to sort of talking to people, and over time, I never felt quite right. There was something that was always missing, and I kept getting drawn into anything where I could be talking to people or understanding why people do what they do. And then one day I went, no, I've got to change. And so I went back as a mature age student and started my journey into psychology.
I love that.
Wow.
Yeah, not sure that that's what I ended up wanting to be an actual psychologist. But every time I did another year, this is more me. And I go to events and this is where I'm supposed to be. So anyway, I decided to, if I could go right through. So I got into a master's program and as a clinical psychologist. And it was around just before I started masters that I did a summer internship with someone, Leah Brennan, who is now a professor and is my long-term friend and research and clinical supervisor. And it was her project that she was doing for her PhD, which was an adolescent weight management program. So I just did some work for her over the summer. And then I decided to do my master's research in weight. It was also, I'm calling it weight management because I'm going to use different terms because this is lifestyle modification, weight loss.
Yes.
So I did my clinical research in that area and created a questionnaire that we tested. It's called the Primary Goals for Weight Loss Questionnaire, and I'm using it again. It's research now because it's really important to my practice. I'll come back to that. So that was my research, and then I became more and more interested in this area, and I knew this is what I wanted to do. So I did one of my placements at the Western Hospital in the what they call the medical obesity clinic there, and that's when they were still doing some surgery, which they don't do anymore. But at that point, psychologists, well, there's a couple of were working in there running programs for people who were doing the medical obesity arm of it. And many of those were hoping to obviously get surgery, but there wasn't enough. They weren't going to take everybody, and they couldn't because there wasn't enough surgeons. And so I got more and more into it, and then I did finish my placement, and then I started to work in regional healthcare centres, still working in this area with patients in the hospital settings. I worked in a renal unit for a while, also with so every time somebody was needed a psychologist who had some experience in obesity, I would be asked to do consults. So that's just, I've ended up staying in the area. So over time, post my clinical masters, once I've just become a psychologist, I got Leah again had suggested that I come and work on a project with Paul and Wendy over at the Centre for Obesity Research and Education Corps. And one of those projects was to look into the mental health of bariatric patients, but this was this time pre and post surgery to see what the mental health diagnoses were and did they change, and that was for lap band patients. So I ended up speaking to over 100 lap band patients on the phone. So that was my forte into working in bariatrics, and that was 2010, because I just looked at my resume. I'm thinking, well, how far back was this? So 2010, I was doing those interviews. So I haven't been out of bariatrics since.
Amazing. I love that.
Yeah.
So
and thank you for sticking with it.
long-winded. It's just
No.
I have a background sort of in lifestyle modification, working right through, and then bariatrics has particularly interested me, and that's when I got involved with ANSMOS, which was ANS at one point, and then it's changed its name. But yeah, so I'm heavily involved in the bariatric field now.
So what do you think are some of the things that we need to know when we're looking at having weight loss surgery?
We're coming back to, I've mentioned the questionnaire that was my baby, looking at reasons for weight loss, starting at that wasn't based on bariatric population, but it has since been used in a bariatric population. Yep. And I think it's relevant across the board, whether someone's contemplating going through surgery or have had it. To me, it's working out the reasons, the whys.
Absolutely.
Very much outside of weight loss. Because we understand it, because it used to mean the fact that it's called weight loss surgery, and I think we're moving away from that because, and I agree that in the surgical space they're moving away from using that term as well, very slowly, but talking about as health surgery, quality of life,
life-affirming surgery,
life-giving surgery, anything but weight loss surgery, because that puts all the emphasis on how much weight you lose and do you lose weight.
Yeah.
And for some people, very little weight loss can actually have very big benefits. But when we put too much emphasis on the amount of weight, I know from psychological theory, which was also the basis of this questionnaire, that that's likely to have an impact on limiting potentially people's successes, because if I don't get the number that I said, then I'm going to be extremely disappointed, and I'm probably not then going to follow through with the strategies that I need to keep me going, because of a whole lot of things. And especially if this is something that no one takes this on lightly. I haven't had a single patient say to me, I just decided to do it. Like lots of research, and as you guys will know yourselves. So if I don't have this thing work, then I have failed all over again, and this is the end of the road. Which really creates sort of the fertile soil then for some of those mental health problems and depression and those sorts of things, if I think that this isn't going to work. So that's why, understanding why somebody really wants to have this and really pinning it on looking at those being more important, and those things being followed through as measures of how is this going for me, as opposed to the weight loss itself.
I love that. I really love that. It flips the focus, and it's such a much more healthy way to frame the whole journey, I think.
And those whatever you decide can be worked on at any point in time. None of those factors, even if you can say, well, no, but it would be easier, say, for me to I want to get back to running. Say you said that, right? It might be that it's very difficult at this point in time. But I can be making small changes now. I can start doing small amounts of walking, and I don't have to wait till I've lost weight or the maximum amount of weight before I can do those things. And that comes about, it becomes about fitness. And so if I want to become fitter, then I can be setting all of these small goals for myself that are completely weight independent.
So that's really about setting our expectations.
I mean, I have that conversation as well about weight loss expectations. It's a standard question all psychologists will ask it, because we want to make sure that, that they're realistic.
Yeah.
Totally agree.
I know when we did speak to Professor Wendy, she was talking about how she prefers to look at it as health-giving surgery, and I know for me, because I was type 2 diabetic, on huge amounts of insulin, and that was one of the first things that I hit, was coming off the insulin, and I knew that the type 2 diabetes was eventually going to kill me if I didn't, get it under control. But that was sort of the first goal that I hit, and I didn't even know that it was a goal.
Yeah.
It was just, to me back then, it was all about the numbers on the scale.
The number.
And it isn't about that.
Right. If you and I had been talking back then, and I'd said to you, so what are the reasons? What difference do you want to make to your life? Would you then have sat back and thought about health being one of the most important things for you?
I would have, because like the day that I decided to have it, my endocrinologist had told me that I had about 2 to 3 years to live because of the amount of insulin I was on and everything.
Right.
And so for me, and I was looking at my daughter, she was only 3 at the time, and I'm there thinking, like, not going to be there to see her get married, not going to, know. And I realised that it was such a health.
So you've actually just mentioned 2 different goals there. One is to improve a current health problem, and the other one is longevity, so that I can be around for my children. And that is such a common response from my clients, or they want to be around for their grandchildren.
Yeah.
To be able to, and then leading from that one is I want to be able to participate in the activities with my children instead of watching.
Yeah.
Yes.
I want to get on the bike. I want to go for the long walks. I want to get on the ground and get up and roll and play and do all of those things. So now we've got 3 different goals.
Yeah.
They're all very relatable. I was the same. I wanted to be there for my children. I wanted to stop being a bystander. But probably, like Damo, I was quite focused, not intentionally focused on the numbers, but I associated success with certain numbers at the start. But that's very, very different now.
It's so common. And that's coming back to self-esteem and self-confidence. It's like, I also, because so many of my clients, and I know the research will bear this out as well, is that the roller coastering of weight gain and weight loss over time sort of had so many people coming from a dieting or weight cycling mindset, where I've been up and down and I felt really good here, and that's why I want to go back to that. And
exactly.
It becomes unrealistic. I felt better about myself when I was X kilos. It's like,
and then there's that constant thing to get back to that. Get back to that.
And saying, how do I feel about myself now? And as a psychologist, there are a lot of ways that you can feel okay about yourself that are completely unrelated to what you weigh.
Yes.
Yeah. Wow.
And I'll work really hard to try and shift that perspective, because, as I just said before, the more the perspective is on the weight loss, and if it doesn't go the way I want, the less likely I am to keep going with the maintenance strategies to even stay where I am. Yeah. Because we don't want weight, even if it's a plateaued weight, it's still better than where you started. So let's stay there and not go here and then to here.
Yeah.
Yep. And a lot of self-compassion work I do these days. A lot of self-compassion work.
Wow. Do you find that people that have set these other goals, getting away from the scale goals, they cope better in the long term? If they don't hit that target weight, they can still see that they're actually getting their other goals?
Yeah, I do. It takes time. especially because so many people have been on a weight cycling journey and they're very used to feeling like, well, unless I'm in a sort of deprivation mode and going down with my, you know, previously it was willpower. Now, at least now I have a tool that really helps. But unless I'm doing that, something doesn't feel right. So unless I'm monitoring, and so much of my homework is to reduce weighing. Yeah, you know, I've still got clients who've done some who've done, you know, we're going to use weight as a measure, it'll come back and say, oh, you know, I've lost significant amounts of weight, and they're still weighing daily because that fear of what if I regain is there from years and years and years of ups and downs and other mental health problems, which I'll get into. And I'm saying, well, why are you measuring? It doesn't matter now. And even if you regain some weight and it stayed there, it's okay. Have you achieved all the goals that you set? And then we'll go back and look through the list, and they're going, yes, but I'm worried about I'm worried about regain. But you're playing, you're doing, you're out there, you're socialising, you're doing all these things. Let's stop focusing on the scale, and then we just reduce it over time. There's a lot of angst around that.
Oh, yeah, there really is. I mean, as somebody I'm coming up on 6 years post Q&Y, and I'm 16 years post lap band. So I've been doing the whole thing for a long time. And I can honestly say that probably for the first 2 years after my gastric bypass, I was very much still in that fear cycle of getting on those scales. Oh my God, what do they say today? How do I feel about myself today will be based on what they say today. And that has definitely taken a massive amount of work that I've done on myself to be able to move away from that, and very rarely stepping on the scales these days. Very, very, very rarely, because that's not where my value is.
Yes, because my worth is not my weight or my weight loss.
Exactly.
Yeah. But I think that from the patients and clients, I'll switch those words, that I've worked with and have had many over time, there's such a strong history of weight shaming and stigma, and that's the other, you know, passion that I have, is trying to reduce that, especially around surgery, which I might get to in a second. But, you know, I've had horror stories of clients as young as, you know, 10, 11 being taken off to Weight Watchers or the other programs that were around, and some of them, I hear the shaming and the treatment and the humiliation about the standing on the scale, and if you haven't, so that being petrified of my judgment, and I don't know if you've experienced that, but I think that
I was 8. I was 8 when I first went to Weight Watchers.
8. You know, I just do this all the time. It's just like, oh my God, self-compassion for those children, for the younger you know, it's.
Tash and I were both lifetime members when we were 12 of Jenny Craig's. You know, we were given our lifetime membership, you know, and it just always reinforced that we weren't acceptable the way we were.
I was very, very heavily involved in dancing and singing as a young person, and the troupe that I was a part of were fantastic, and I wasn't shamed or anything like that by them. But we went for an audition back in Expo '88. We were auditioning for a particular show, and we turned up, and there was about 500 people in the room, and we'd done our performance, and they announced over the microphone that my particular troupe were accepted, and we were going to be dancing in this particular show, all except for the little fat girl, and that was me. And I lost 16 kilos in 12 weeks so that I could perform. And I also got an eating disorder for the...
I was about to jump in there. This is my other area of interest. I work a lot with eating disorders as well, bariatric or not. And it's exactly, that's the grounds for setting up lifelong...
And that's what happened. So,
I like food and I hate food.
It was one of the most horrifying moments of my life. in front of so many people.
Oh,
It's just terrible.
utter humiliation.
Yeah.
You know, and you're trying to understand where that comes from. There's no excuses.
No, it
was just so
a very different time.
Exactly.
My poor mum, I can still remember her face and everybody's faces around me.
Mm-hmm.
And
yeah.
And I just so desperately wanted to do what I loved and to fit in that I was willing to do anything.
Including hurt my body. Yep.
That's
my
right.
soul and my body to do this.
Yeah.
Rather than just be accepted for the skill that I have.
Yes, that's exactly right. So it took such a long time to work through those things.
Yeah. And as a psychologist, when we're doing assessments, this is the sort of information that I would want to know when I'm asking about childhood experiences. It's to find out what's going to be going on and how am I going to view the world from they're called schemas, through the lenses of what messages was I told, and one of them is defectiveness. So, I'm being told, even if it's subtly, it might not be actually spoken, that somewhat I'm flawed and defective.
Yeah.
Not quite acceptable.
Yeah, that's right.
Yeah.
And if we're very honest, of course it's something that even to this day I remind myself, no, that's not how you are.
Yeah.
Because those things that are spoken to us, for me anyway, they then became my inner voice to myself and the things that I told myself.
Yeah. I do a lot of work with my clients with the inner critic. We talk a lot about that shaming part, but what's it trying to do as well, Yeah. And it has a motive. It sort of wants to help you by keeping you motivated and on top of it, but it's very unhelpful because it's usually the voices of anybody that was in our past that wasn't helpful, and society, because those societal messages are everywhere.
Yeah, they are.
Talking about mental health, that's probably one of the primary reasons that depression it's such high proportions in this population, as well, just to be told every day, everywhere you go, that you're not okay, that you're not right.
Yeah, that's exactly right. Exactly right.
I know that. On behalf of psychologists, we fall into this just like every other medical professionals will, or allied health, that we do a good dose of shaming clients as well. Not so much people that work in bariatrics, I won't say that, but research shows that out too, that going to the doctor is one of the most, can be a horribly shaming experience.
Yeah, unfortunately it's very, very true.
Yeah. And that's if you're going to somewhere where you're expecting support and some strategies or referrals, and you walk away feeling worse than you went in there, then leads back to who doesn't get help. I'm not going to go near anyone else, and so now I don't do anything.
Yeah, that's right.
So I'm not going to reach out to people that can help me. So I think that's part of the problem too.
Yep, I agree.
Wow.
Well, I don't know. Did I answer your question?
Yes,
definitely. It's giving me a lot to think about. I've never had an issue going to psychologists, and I was just, when you said even psychologists can add to that that issue. I had an accident and I'd fractured my pelvis and I developed PTSD, and as part of it I needed to see a psychologist. And we were just talking one day, and it was innocent enough, but he said, as I said about having weight loss surgery, and he said, did you try diet and exercise? And I remember just sitting there.
No, not at all.
I've never thought about that.
The thoughts that went through my head, I don't want to repeat them, but it was just like the most disempowering moment. I'd lost 110 kilos, and he was saying, "Oh, why didn't you try diet and exercise?" It's like, mate, I'd tried everything before I decided to let someone cut me open.
Yep. But it is, you could say it's an innocent comment, but it is showing an internalized somewhat bias there
Yes.
around what people think about this. And, some colleagues and I, we really are trying as we through ANZOS and organisations like that, organisations like that, where we're getting the opportunity to actually speak up and run courses to teach other health professionals. But we've all included a very big weight stigma section now for us to really understand our comments and also the experiences of what you guys experience when you go to someone and they have that sort of make those sort of comments, but also not seeing bariatric surgery as a positive step as well. And I try to educate friends and colleagues myself around surgery because I think there's a limited understanding about it as well.
Yeah. I mean, we've had people sort of say, I've had people tell me that it just shows how lazy I really am that I'm having weight loss surgery. And it's like, people just don't understand it, but it seems like a lot of people don't want to understand.
True, and once again, it comes back to are we seeing this as a really bad thing? That how whether it's dangerous, it's so extreme, all of these ideas, or that we should just be and then there's that accepting of oneself, and which I agree with. But when we're talking to a point where I can accept myself, but my quality of life is suffering over here, and am I going to just keep going and getting worse and not being able to achieve all of my goals because now I really have serious joint pain or whatever else is going on.
Yes.
That's why I say it's just another tool. It's a life-giving surgery that allows you to do these things. It's certainly not an easy way out, and not one single client has ever said to me, "Oh, gee, I now realise that this was a really easy way out." But they come to me with that internalised. It's a bias internalised. So internalised weight stigma, we call that, like, oh, maybe I have failed because I have to go here. I've had to get to this point.
Yeah.
We do a lot of work on changing that, or I don't want to tell anybody.
Yeah. I mean, I know when people started finding out about my surgery, I definitely lost some friends.
Yeah.
And I know, and Damo said to me, because he'd lost so much weight and was so inspiring to me, but he said to me, I don't ever post about it. I don't really ever talk about it because people, by and large, don't want to know. And I thought, wow, okay, that's a bit, because when I'd had my lap band, people were fairly curious. Yeah. And so I posted a few little things, and the backlash was, wow. Like, I mean, some people were really happy and positive, really interested. And then there were other people who just flatly said, you have taken the easy way out. Oh, well, now you'll have lifetimes worth of complications and all of these other things. And I thought, goodness me, I didn't realise that people wouldn't be happy for me.
There's a psychological element aside from the judgment side. Everyone's got their own opinions about things, but there can be other sort of social psychological elements to that too, because there's threats there too in friendship groups, in relationships. So we're talking about the sort of other psychological issues besides the classic depression and eating disorders, obvious ones, mental health conditions. It's these changes, like the threat. Well, what's going to happen if I'm used to sort of seeing myself in comparison to you, and then you do this and you lose a significant amount of weight? How am I going to feel about me?
Yep.
Yeah, I don't know whether either of you have experienced that, but that some of my clients will report that. Spouses finding it really hard to deal with.
Yeah, absolutely.
My partner's getting, comments and compliments.
Yes.
Yep.
What if they leave me?
Yep.
Yeah. So it can lead to sort of subconscious sometimes, or maybe deliberate, but often, just unconscious sabotaging of, I'll just have this, just doesn't matter. You keep having
Yeah.
Yeah.
We would see probably on average 3 or 4 relationships are posted about ending every week. You know, and because, you know, for one reason or another, the partner or the person that's had the weight loss surgery just isn't.
Things have changed. The dynamics have changed. Things change.
I remember going to a Christmas party for my wife's family, and one of the brother-in-laws turned around and said, "Oh, Damo's no longer the fattest in the family anymore." And I heard, I was sitting right there, and I was just like, how do you even respond to that? You know, like, and that one, he unfriended me on Facebook because he's like, "Oh, I don't want to see all your crap about," you know, and it was just like, what the is
So
going
on? What do you think was going on for him?
Well, he'd put on a fair bit of weight, and you know, I was losing it. I realize it's probably jealousy, but it was also the fact that I'd cheated apparently to lose it. Whereas, you know, if I'm going to lose weight, I'm going to do it the natural way.
Yeah.
And yeah, it just
it's actually nothing really to do with you, and it's all to do with the other, because we talk about these parts of ourselves, and there's this sort of angry, frustrated part, like, oh, I can't do this, or I want to do this, is going to be really difficult, and now I'm seeing you doing it. And so it's over here, but I've got to lash out over there.
Yeah.
Yep.
Yeah.
That's exactly right.
Yeah. And also our roles in families change. So if you had that role and you were seen as that, and now you're not that, well, how are we supposed to relate to you now?
Yeah.
Yeah. So obviously it's hard for you to respond in that way. Sometimes there's no response is
yeah.
Just to agree that true.
Yeah. From memory, I actually said, "Oh, I'll send you some of my old clothes." You know, but it was just like in that moment, I was just sort of stuck, like a deer in headlights, but also wanting to say something to defend myself. But, you know, and then it's like, well, it's Christmas, we're all meant to be happy. You know, and it was just so
it comes
awkward.
back to that need to defend. Why do I need to defend myself? I've done something to save my own life.
Yeah,
like
that's
they me.
Exactly it.
Yeah, definitely. So, you know, we certainly see some interesting stories.
Yeah,
and that's why. That's where we're talking about the role of psychology. Sometimes in the early phase, like the pre-surgical phase, if you do get to see a psychologist, these are the issues that are really worth talking about. That we can preempt some of these changes that might happen, and have strategies already in place to think about. Well, when this happens, what might you do? Because we know enough now from most of the psychologists working in Sarah, have been working in it for a while, will know that this comes up over and over again. So we're going to go, you will, and I say that to mine, you will find this. Yeah. But on the flip side too, for some people, we're talking about why you might stop using your strategies and start regaining if you're not doing what you need to do, can be around the attention does stop. So early on, for a lot of people, and this is not to do with barrier, this is at any point in a weight loss journey, especially in that cycling, there's a lot of attention to the, oh, wow, you look good, because it's a comment on the weight loss again.
Yeah.
And that can be really affirming.
Yes.
Like, oh, yay. And it can be motivating, and I want to keep going. But at some point, it's going to plateau. Your weight's going to, there's a point where life is happening, and then people aren't noticing anymore. And for some people, that point, that loss now, if I haven't replaced, because if I'm not focusing on the right things, and it's only about how I am in relation to others and my actual scale weight, then I'm going to be more likely to be vulnerable to when that starts to happen. And it's like, oh, well, and I start to slowly erode healthy habits and start slipping backwards. And for some people, you can end up on a never-ending roller coaster of that, because I have to get onto it again, and then it happens again. We want to, stop all of that. So preempting things like that's useful too.
Yeah, I totally agree with you.
Yeah.
I think that's Damo and I have talked for a long, long time about these sorts of issues and how life affirming the surgery is, but also the desperate need for psychological assistance from the very beginning.
Yeah.
Prior to the surgery, in the lead up to the surgery, and then post-operatively, particularly in the first year. I believe that the mental health aspect is as important or more important than all of the dietary considerations put together, purely because of just how powerful our mind is in the way that we do our lives. And it's something that we feel extremely strongly about.
And I hear you, and I totally agree. But I think the shift has to come too is the role of what a psychologist's role is in a MDT, or just someone like me who's independent. Like what is our role in pre and post?
Yes. So talk us through